Hello everyone, I am Nikitha, Assistant Professor from Yenepoya Physiotherapy College. Today I am going to discuss about the topic known as relaxation. Relaxation is one of the important component when it comes to treating the patient. So we'll see what are the requirement as well as types of relaxation. Okay, first specific learning objective of this topic. At the end of the chapter, student must know about the definition of the relaxation and the type of relaxation, techniques of the relaxation, and what are the clinical application of relaxation. These are SLO of this particular topic. So contents. In this particular PPT, we have definition of relaxation and type of relaxation, techniques of relaxation, and what are the indication for relaxation, as well as the summary of the topics. First, muscle which are relatively free from tension and at rest are said to be relaxed, and the technique which used to make this muscle free from tension is called as relaxation. Before knowing the relaxation, we should know what is muscle tone as well as what is postural tone. When it comes to muscle tone, it is a quantity of firmness retained in the muscle even when they are relaxed as possible. And when it comes to postural tone is the contraction which persists in our muscle concerned with the maintenance of the posture, and it is called as postural tone. So these are the tone which will be present even when it comes to rest. So when it comes to relaxation, we should make sure that the body as well as entire muscle should be relaxed, free from any resting tone should be present during the relaxation. There are two types of relaxation. First one is general relaxation and the second one is local relaxation. So general relaxation means it is for entire body, and local relaxation is for particular part of the body if there is any injury or anything, something like that. Okay. So local relaxation is something when the part of the body is affected. Now particularly let's consider the knee joint. Okay, we want to keep that knee joint in a relaxed position. That is local relaxation. But when it comes to general relaxation, it is related to entire body. And there are so many techniques which can be used for the relaxation. There are few requirements for the general relaxation as well as local relaxation, that is support, comfort and restful atmosphere. We can achieve the support by making the changes in a lying position and by the use of the pillow. By this we can achieve full support of the body. Let's see how the support can be achieved when we want to attain relaxation. There are different lying positions like supine lying, prone lying as well as side lying. Okay, in these different type of lying position, we can keep pillows, and by this we can reduce the tension within the muscle, and by that support can be attained. Let's see how it can be attained. Now as you can see, this is one of the diagram where the pillows are kept below the head, as well as there is one pillow which is kept below the elbow region, and one more pillow is kept below the knee region, and other one pillow is kept below the sole. Okay, these are the pillow placement which can be used for attaining the support during the supine lying position, and by this all the joint wherever the pillow is placed, that will be free from the tension. It is in semi-flex position. As you can see, knee is in semi-flex position, as well as the ankle is in dorsiflex position, and the elbow is in semi-flex position, as well as the pillow one more is kept below the neck region. Okay, this is how the pillow placement will help in support. Next we will see the half lying position. So we can see two diagrams are there. Half lying position, so the pillow are kept below the hand as well as below the knee, and one more the pillow is kept below the sole. So the ankle is maintained in semi dorsiflex position, and other one is half lying position, and instead of the pillow you can also give the foot rest, which can reduce tension within your dorsiflexor as well as plantar flexor. So this is a method where you can use the pillow while lying side lying. So the pillow is kept below the head as well as between the hand, and one more pillow will be kept between the leg. This is a position which usually pregnant ladies also attain to sleep during their pregnancy, and for them also this pillow placement will relieve the tension in particular joint, as well as it will give support to the patient when they are lying. Okay, there was a second requirement for the relaxation, that is comfort. So it can be attained by the freedom of breathe deeply and the warmth, as well as abdominal inactivity, and mild degree of physical fatigue will help in increasing the comfort. So if the patient is wearing any tight clothes, otherwise the belt or those things should be removed. Okay, the patient should be able to breathe normally, and the room wherever the treatment is given, that should be warm, and like as soon as the patient has had food or something, we should not give the exercise, otherwise when it comes to comfort, abdominal inactivity also play a major role. As we all know that as soon as you have a food, within half an hour to 1 hour, we are not doing any of the exercise, because there will be activity going on with your abdominal area. So abdominal inactivity also play a major role. If there is abdominal activity goes on, we cannot give the exercise, we cannot prescribe the exercise. So if the patient has food, immediately we cannot give any exercise. We should give the exercise after half an hour, otherwise 1 hour. So these are all play a major role in attaining comfort. And if the patient is wearing any constructive clothes, a tight cloth, belt or corset should be removed, because it is going to restrict the breathing, and the room should have warm and free supply of the air should be there to and the treatment room should be warm, as well as there should be a free supply of air throughout the room, so that the patient will be comfortable when we are giving the treatment. So third requirement of relaxation is a restful atmosphere. It is nothing but the place where you are treating the patient. It should be quiet as possible, so that the patient will be comfortable and the patient can concentrate on breathing and the technique what we are giving, otherwise the exercise what we are giving. The place where we are treating the patient, if it has more noise, otherwise too many people, the patient will not be comfortable and he will not concentrate during the treatment. So the restful atmosphere also play a major role when it comes to relaxation. And additional method also can be used for the relaxation. You can ask the patient to concentrate on his own rhythm of breathing, and it should be deep with a slight pause at the end of the expiration, and you have to ask the patient to concentrate on his breathing. This is going to give additional benefits when it comes to relaxation. So when it comes to relaxation technique, there is important relaxation technique that is known as Jacobson's relaxation technique. In this, we have to ask the patient to contract any group or the series of muscle as strongly as possible, and then we have to ask them to let go and continue to let go. Okay, it can be done from like proximal to distal, otherwise distal to proximal, and the routine contraction followed by relaxation is carried out in each area of the body. Like we can start with the toes, we can ask them to contract as much as they possible and then relax. Then the other part of the body, slowly we can ask them to contract and relax. So this is one of the technique which is used for the relaxation. And there is one more technique which can be used for the relaxation, that is passive movement. So passive movement of the head and limb may assist the degree of relaxation in some cases, and it should be sequenced like one by one, and it can be given for group of patients like pregnant women, asthmatic patients. We can give this passive movement. So when you are giving the passive movement also, it should follow the sequence. You can do the larger muscle group, otherwise larger big joints at once. Then you can go for the elbow, like first you can start with the shoulder joint, then go for the elbow, then the fingers. So even when it comes to lower limb also, like hip to knee movements, then the knee flexion and extension movement, then you can do the ankle dorsiflexion and plantar flexion movement. So it will also help in a relaxation of that particular part of the body. So as I was telling, when it comes to relaxation, there is two type of relaxation. First, whatever we have discussed, that was general relaxation. Right now what we are discussing, that is local relaxation. So the indication for the local relaxation will be pain, spasm, if there is shortening of the muscle, So when it comes to relaxation, as I already told you, there is two type of relaxation. One was general relaxation, other one is local relaxation. So the local relaxation is nothing but when particular part of the body you want to relax. Maybe it can be there is an injury on the knee joint. That part you want to relax. Otherwise there is an injury on the shoulder joint. You want to relax on that particular part of the body. Okay, that is local relaxation. And general relaxation will be usually given for your pregnant women. It can be given for the asthmatic patient. It also can be given for the fibromyalgia as well as your myofascial pain syndrome conditions. Okay, and there are few indications for your local relaxation, that is pain, spasm, otherwise if there is a shortening of the muscle. And the method which is used for the local relaxation will be your manual stretching and isometric contraction. So whatever the things requirement I have already discussed for the general relaxation, everything is gonna play a major role in when it comes to local relaxation also. You need to see that the patient have a proper support. You need to see that there should be a comfort as well as restful atmosphere, even though you are concentrating on local relaxation. Okay, now we have come to the end of the topic, that is summary. When it comes to summary, the technique which used to make the muscle free from the tension, it is called as relaxation. And there are two type of relaxation. One is general relaxation, other one is local relaxation. And indication can be pregnant ladies, asthmatic patient, as well as it can be given for the fibromyalgia, myofascial pain syndrome, otherwise any spasm condition, the relaxation technique can be given. And when it comes to requirement, it is support, comfort as well as restful atmosphere are the requirement for attaining relaxation. Thank you.